This afternoon, we are chatting to Michael Swain from Freedom of Religion South Africa, and we are talking on the topic of the World Health Organization. Now, when I hear the World Health Organization, I think WHO, Michael, and I think COVID-19 pandemic. The hair on the back of my head starts to go up. I get rather concerned, and in actual fact, that's exactly what we're talking about today. It turns out that there's a whole raft of new regulations and amendments and pandemic agreements, and already I'm a little bit nervous to hear what you're about to say. But maybe you can step us through this, Michael, starting with what are the international health regulation amendments and the pandemic agreement? Why were these things drafted in the first place?
Well, this is actually part of a long process, and we've actually spoken about this before and flagged some of the issues before, but it's again coming to a head, so to speak, because they're now trying to formalize it and to ratify it. And in all honesty, I think that many people have actually no idea what's going on. They don't even necessarily know who the WHO is, or what they exist to do and what they've done in the past. So maybe the first thing to do is to actually, talk about who they are. The WHO is one of the sort of entities that stems out of the United Nations. They are largely based in Switzerland. They consist of so-called experts, many of whom have little or no medical experience. They are obviously highly paid, they're tax exempt, they have diplomatic immunity, so they're basically completely unaccountable. And yet they have significant authority over the whole health sector of the world. That's why their name is the World Health Organization. Again, not without controversy, particularly after the way that they handled and managed, quote unquote, the last COVID pandemic. So we can talk about that a little later. But what they've been doing and what they've done is they've amended the international health regulations that everybody supposedly agrees to and consolidates around. And they've also drafted a pandemic agreement. And they've done this, of course, in the light of the health emergency, if we want to call it that, that arose from the COVID-19 pandemic. The supposed purpose is to ensure that member states are better equipped to deal with future public health emergencies. But as we've said, the amendments and some of the provisions of this treaty are concerning, and they raise concerns specifically around national sovereignty, around religious rights, and of course around free speech rights. So let me just step back and give a little bit more detail on what these amendments are. There are two global health amendments and instruments, rather, adopted by the World Health Organization post COVID-19. These, what they call IRH amendments, they update existing rules on how countries should respond to what they call public health emergencies. And the pandemic agreement, which is also called the treaty, is a new instrument which is meant to ensure better preparedness, cooperation, and resource sharing for future pandemics. So, according to the WHO, they claim to improve how the world responds to pandemics. They want to enhance early warning systems. They want to have data sharing. They want to ensure fair access to medical tools like vaccines. And of course, while again, the intention is perhaps commendable, it's always the implementation that raises serious constitutional and human rights concerns, especially around things like bodily autonomy. Do I have the right to do what I want with my body? The answer should be an emphatic yes. Freedom of speech. Am I allowed to say what I like about these issues as and when they arise? And of course, freedom of conscience and religion. Do I have the right to continue to practice and to live out my faith without unnecessary and often draconian measures being brought into play to prevent me from doing so?
Michael, as you're talking, I've got flashbacks to just a few years ago and what we lived through. Some of which might have been necessary. We didn't really know what was going on, particularly in the beginning. Um, but I don't have good memories of that time. I do feel like there was significant state overreach, and certainly players on the outside engaged in the South African state. I'm sure that's what we're going to be be talking about shortly. But maybe my next question is, when I think of health, I don't often make the leap to religion, short of fasting regulations and that kind of general maintenance of one's body because it is a temple unto the Lord. Um, but yeah, we're talking about the World Health Organization and we're talking about freedom of religion. How do these things connect? Where is the touch point? Help me make sense of this.
Well, I think we all discovered what the touch point was very quickly during the last COVID-19 lockdowns. It is interesting that, up until that point, often when we 4SA had been speaking to faith leaders about religious freedom, their view was, look, we've always had it, we're always going to have it, it's fine, don't worry, it's not a problem. Yeah, thanks for what you're doing, but it's okay. And then lo and behold, everybody's churches, mosques, temples, you name it, were shut down and kept shut down. And I think you correctly pointed out that, of course, at the beginning, in the initial stages, we did not know, nobody knew what this so-called COVID-19 virus was about, what it would do, who it would impact. Uh, Obviously, it was potentially a very serious health threat. And therefore, I think everybody was, if not in favor, but certainly, agreeable to the thought of let's 15 days to flatten the curve was, if you might remember, the sort of mantra that came out at the beginning. We were all banging pots and pans outside our house, thanking our brave health workers. And it very quickly became obvious that actually the measures that were being taken were not actually reflective of the evidence that was increasingly coming out on what this disease actually did and the impact that it had, and therefore what reasonable measures should be taken to curb it or to curtail it. And obviously, public health is a critical issue, and as religious leaders, we must always be sensitive to that. And we also said, by the way, that everybody should follow their own conscience in that regard. We were never pushing for any particular course of action for any faith community to follow. What we were concerned about, obviously, was the fact that some of these measures were simply unfairly discriminatory against the faith communities. And we were, as I'm sure you'll remember, locked down, not just locked down, but you were not allowed to have a religious gathering, which was two people gathered together simply to pray. That was a religious gathering. So you were faced with a ridiculous situation whereby you could go to a casino and you could sit side by side next to somebody and you could both be pulling the slot machines. And, if your losses mounted to a certain level that you were getting a bit concerned and you turned to your next door neighbor and said, hey, can we pray and ask God to help us change our luck? Not that I would ever recommend anybody does that, such a thing. But at that point, all of a sudden, this was a serious health threat because we were now having a religious gathering and we could have both been arrested and put in jail for up to 6 months. That was clearly unfair discrimination against the religious sector. And we had to fight right from the beginning, even for religious leaders, religious practitioners to be recognized as an essential service, which of course they were right from the front line, because that was where religious leaders are in these situations where society is suddenly troubled and affected.
Mhm.
So it was something which was very concerning from a religious freedom perspective. And again, I don't think that we would want to face that type of situation again. But unfortunately, particularly if we look at some of the possible outcomes of such a treaty, it is a realistic possibility that it could come around again. And by the way, just to remind those people who may be watching this, it was 4SA who took on the COGTA department that was obviously issuing and managing and monitoring these regulations. And the day before we were due to go to court, they then withdrew that particular draconian and unfair regulation, and churches opened up again.
Mm.
So thank God for that.
Yeah. Oh, yeah, Michael, just remembering particularly that casino church illustration while you were talking, it was really at the forefront of my mind. I was going to bring it up if you didn't. I remember that distinctly. But I also remember the need to serve people during that crisis. We had a lady pass away in the so-called first wave, and the need to give religious support to the family, to a grieving husband, and the complexity of getting that done, and the kind of choices that pastors were sitting with. This is in our recent memory. And so this naturally brings us to the question. So the World Health Organization has a new pandemic plan. What kind of sway do they have with the state? How bound is South Africa to follow this plan? As a country, are we under legal obligation to do all that they say? Do we opt in? Do we opt out? How does this work?
Well, there's lots of questions, but I will try to answer them. So, on the surface, the final text that is being adopted affirms state sovereignty and human rights, but it does still leave room for national authorities to impose sweeping health measures. For example, forced vaccination, restrictions on religious gathering, and there are no proper safeguards for people who may object on religious or even moral grounds, or even just simply because they don't agree with what's being put forward. So there is no final agreement. The final agreement explicitly states that the WHO cannot mandate such actions like lockdowns or mandatory vaccinations, but national governments can, and they often do, follow WHO guidance closely. You might remember. And
Mm.
unfortunately, with the guidance that they gave the last time, it was an absolute flip-flop. First of all, it was, we don't need masks, then we do need masks. Then it was everybody must be vaccinated and stay locked down until the vaccination comes out. And then they came out and it was they are safe and effective. And then lo and behold, it turned out that they were neither safe nor effective. So the WHO in itself has not at all improved its reputation as an institution as the way by the way that it managed the last one. But nevertheless, it has significant clout, obviously, and it may well result in a lot of pressure, whether direct or indirect, on nations to adopt and follow this treaty and whatever it says without reservation. And again, without these proper protections, this influence could lead to all the restrictions that we've mentioned that violate religion, belief, conscience, bodily autonomy, and so on. So, yeah, does South Africa have to follow these? Well, no, they don't. But we only have until the 19th of July this year to file reservations to these IHR amendments. And we also can ratify or not the pandemic agreement with conditions or interpretive statements. So, one of the things that we're doing is we're calling for Parliament to exercise these rights to protect our constitutional freedoms. And
Mm.
we also want to very urgently suggest that Parliament scrutinises both these international instruments, the pandemic treaty and the regulations amended, and then invite public comment, even if they're not required to do so. Because whatever the outcome is, if this goes into play and it is adopted, then we all will be influenced and probably have our lives potentially significantly disrupted as a consequence. And again, we want to see South African law specifically strengthening its domestic health laws to embed these clear protections for religious freedom, for bodily autonomy, freedom of expression. We can chat about that in a minute. And of course, freedom of movement.
I'm just thinking of freedom of speech for a moment, because you and I have spoken in the past of how connected our freedom of speech and our freedom of religion is. I've got flashbacks to television and Australian news of police banging down doors and taking people into custody because they had said the wrong thing on Facebook with regard to the shutdowns. Maybe you can just talk about freedom of speech in particular. Do these agreements affect freedom of speech? You mentioned it earlier, but maybe just pick up on it a little bit more.
But yeah, the biggest concern lies in the International Health Regulation Amendments, specifically in part of them, which is Annex 1. And that requires all countries to build the capacity for what they call risk communication, including addressing misinformation and disinformation. There are those two words again. Now, the word originally used was to counter uh, misinformation and disinformation. Now it's been softened to addressing misinformation and disinformation. But of course, that should do very little, I think, to ease concerns about censorship, because the underlying obligation on states remains unchanged. So, what does this mean? Well, even though the clause was moved out of the main body of the text into an annex to make it less sort of politically charged, it's still a legal requirement for each country to develop these mechanisms to monitor and respond to the so-called misinformation, and it is still fully binding. And that, of course, raises or should raise some big red flags because it could justify governments' efforts to suppress or even penalize dissenting views, whether they're from a religious, ethical, or even scientific perspective. And I think let's just remember, and most people have absolutely no idea that this even exists, but in October of the first year of the pandemic, a very powerful and extremely well qualified group of senior scientists from all the disciplines of immunology and virology and all the rest of it, including Stanford professors and Nobel Prize winners, got together, looked at the evidence, because now the pandemic had been running and you could see what it did, who it affected, who it didn't. And they came up with an alternative, which was called the Great Barrington Declaration. You can Google that if you like, which basically proposed a completely different global strategy, which was far less invasive, imposing, far less draconian, much more reasonable, and completely viable in terms of the alternatives that it was putting forward, which obviously did not involve the hard lockdown that we still had to endure for almost another 2 years. That was ruthlessly suppressed as a story, particularly by the US government officials and obviously with the collaboration of other social media platforms. And those people who had put their hands up or their names to that had their careers and reputations systematically destroyed. Now, it's actually quite interesting and wonderful that one of the main signatories of that was a man called Dr. Jay Bhattacharya, who's actually been appointed now to a senior position in the medical side of the Trump administration. But nevertheless, it was indicative of just how so-called misinformation and disinformation can actually simply be used by states to enforce whatever particular regime that they want to implement. It had nothing to do by that stage with the actual health consequences. So we do have to be very careful of this. And of course, this particular document says that a future health emergency, governments or regulators may well interpret this clause as a mandate to censor legitimate speech, which would include religious teachings, conscientious objections, minority scientific opinions. And we need the domestic legal safeguards to ensure that there is a real robust protection to freedom of speech, which our Constitution guarantees. And it certainly should not be, chilled or even criminalized under the guise of so-called protecting public health.
I remember during the last pandemic, people getting fired in their jobs because they didn't take the jab. There was a lot of conversation around freedom of conscience. Any conversation around that in this set of agreements, in this raft of agreements?
Well, all these things can very quickly and easily come back into play. Including, you might remember vaccine passports was a big thing. And you had to have, in many countries, actual proof, without which you could literally just about neither buy nor sell. You weren't allowed to go into restaurants, you weren't allowed to go into clubs, you weren't allowed to travel if you didn't have one. It was interesting. Some nearly 3 years later, I was booked to go and visit my daughter in Indonesia, and I arrived at the airport. And I mean, this is like end of 2023, like long after this whole thing has gone away, so you might think. And I was asked at the airport, "Where's your COVID vaccine passport?" I said, "Is that even a thing?" I said, I've got a certificate that shows that I, had a check and I'm not infected or whatever." Nope. Unless I had proof of vaccination, I was not allowed to travel to Indonesia, and I was literally bumped off the plane. So it just goes to show how restrictive things can happen that are very detrimental to our basic fundamental human rights, like freedom of movement and speech and all the rest. So we must be aware of these. We are concerned that this seems to be flying right under the radar, and our government doesn't seem to have flagged the issues. We see nothing in the media about this, but it is nevertheless something which I think we all, particularly faith leaders, need to be aware of and concerned about and pushing for answers and engagement by the government on, so that we don't find ourselves in these worst case scenario situations again.
Michael, freedom of religion is a legal lobby group, both to government and then making the country, making us as citizens aware of what's going on. You mentioned this legal framework, this agreement related to the pandemic. You also raised an annexure, particularly in terms of the freedom of speech clause. Does that mean that there are aspects of this that countries are free to opt into and aspects of this that countries would be free to opt out of? Is it kind of like a menu system where you choose what you want to engage with as a state? Is that how it works?
Well, that is how it supposedly works. In other words, it does say that it respects national sovereignty. But as we saw, and as I mentioned earlier, you know, once a pandemic, whatever that might look like, strikes, and there's suddenly national, international, and other pressure to come up with a conformity, which would obviously have a global solution, because this is all about trying to find, I think, a one-size-fits-all global solution, then we may find that all the so-called checks and balances and verbal assurances just simply go straight out the window again. Um, so yes, supposedly you can opt in, and you don't have to, for example, have mandatory vaccinations or vaccine passports or all the rest of it. But in practice, who knows? And that's the problem. I think there is so little credibility left for institutions because of the way that the COVID-19 pandemic was handled. That really it is something that we now need to be doubly vigilant about and to scrutinize very carefully before we put our name to it as a nation and sign up for whoever knows what consequences may follow.
Michael, if you had the ear of the president and the ear of parliament and a few minutes to chat to them, what direction would you give them? What would you ask them to do? What would be 4SA's path forward in terms of this particular question?
Well, I think the one thing would definitely be to, put very robust protections in place, particularly around the area of health, for religious freedom, for bodily autonomy, for obviously freedom of expression and the like. And also to scrutinize very carefully and to give very due and proper consideration to the potential consequences of signing up to a treaty that will actually be binding upon all the citizens of the Republic of South Africa. And as such, we would also be saying we believe that this matter should be opened up for public participation so that the public can actually also have its views taken into account, even if that would not be binding, but it, I think, would be very informative to government. And it should, I think, give a proper pause for proper and due consideration.
Mm. Michael, I'd like to take the opportunity just to point any listeners to where they can go and find out more information about freedom of religion South Africa. They can go to your website, that's 4sa.org.za. There they can find video and various different written articles around a whole host of issues that are facing the freedom of religion in South Africa. And then maybe just point people to your socials as well. You are on YouTube and Facebook in particular, and they can see relevant information there. And of course, sign up for the newsletter and support you on your website. That's forsa.org.za. Michael, as always, it's a pleasure speaking to you. Thank you so much for keeping us aware of what's going on and for raising the flag when needs be and raising the alarm. I do trust that as people listen, they will engage further.
Thank you, Mark. It's always great to be with you, and thanks for giving this opportunity.